I've seen you going to a lot of schools.
This is predominantly to collaborate healthcare and education together.
Okay. And when you say that, what exactly do we speak? How do we collaborate?
So to begin with, we get in touch with the family, or the school refers the child to us, whoever has a developmental need. And then we step in as a healthcare team who analyzes the child's development, behavior, understand the learning abilities. Yes, so let's say the child has concerns with development. This could be language, communication, learning, attention, behavior, anything at all. So the school refers the child to a developmental pediatrician. So we are able to analyze what the child needs, where the gaps are, or where the strengths and needs are. And we step in along with the school to help the child. So it's going to be multidisciplinary. The parents, healthcare professionals, school, allied therapists who are going to work towards the child in collaboration.
Inclusivity. Do you speak much about that?
A lot.
And this is only with the team of the people that work with the child. But beyond that?
Beyond that as well. So we also cater to, let's say, educating other children in the classroom, educating the teachers, educating the siblings, the peers. So bringing in the inclusive environment in school and outside as well to see how best to support them.
Can we speak a little on that?
Yes.
So how do we educate the children?
So we do have a lot of fun activities. These could be by the teachers. Some of them are through us and the therapists, where we try to help them understand at their level what neurodiversity is all about, like how each child can maybe look different sometimes, especially if they're syndromic, let's say Downs or other genetic conditions, or their abilities, like some of them might have dyslexia, so their learning could be very different from what the rest of the class could be. So helping the child understand how each of them are very unique, and as peers, how we are supportive towards them, which avoids the child feeling excluded. And we see a lot of times the peers participate. So, they may have a study buddy who's going to come in and say, hey, look, let me help you with this math because I know this is a challenge for you. Or some child who has attention deficit usually has a study buddy. So this child might daydream sometimes, zone out. So it could just be like a small nudge. Hey, come back, the teacher's talking or asking you a question or repeating for them or organizing things for them. So they tend to become a lot more supportive because they understand that these are the needs of the child and how best they can work together.
And what age group is this that you were talking about, study buddies? Usually
maybe 5 and above.
Oh, that young?
Yes.
Okay.
Yes.
And how's the acceptance?
It's quite good among children. Especially when right at a young age, they're exposed to something like this. They understand a lot better, and we see peers are extremely supportive. Like we've had a lot of parents who do not want to move the child to another school because they've established that peers around. There's somebody looking for them. Let's say they need to go out for lunch, library, change tasks, or the teacher's asking a question. There's always like a group of them who are ready to help this kid. So I think that really brings in the supportive environment for them.
So when you say acceptance is good with children, how about the adults, the acceptance with the adults?
It's good as well. A lot of times we see it's mutual. In a way, we do train parents as well, like parents of neurotypical children, as to what these conditions are. And
so neurotypical is the child that don't have needs, especially extra needs. Okay.
Yes,
okay.
Yes. Neurodivergent are those who have any kinds of needs, which may be a challenge to any aspect of their development.
Okay.
Yeah.
So you said that you speak to the parents of neurotypical kids.
Yes, so we do have coffee mornings where we try to explain to them. We just tell them what are the activities we do around, just giving them an understanding, even as a layman. It need not be just to the kids who's, the other peers in their kids' classes, but even in a general environment, because parents can have a lot of colleagues who are neurodivergent, or they could have other family members who are neurodivergent. Yeah.
What about the training for teachers and teachers' assistants?
Yes, because I think that's a part of KHDA training as well. So a lot of teachers do have an understanding into this. They have a separate team in every school called the SEND department, which is the Special Educational Needs and Inclusion Department. So they do have a lot of understanding about diversity, needs, and they do come in very often. We do have a lot of inclusion conferences where this is more like advancing. So we go on to beyond what is the latest research or publications that have come up. How can we kind of adapt that into our community in the UAE and things like that.
Now, I've seen your LinkedIn is pretty busy with a lot of workshops. One of the topics that really I thought we could call you in and ask you further is about inclusivity,
Yes.
awareness, and acceptance, because these three things are very different.
Yes.
And although we are getting there, how exactly can we go wider?
We're also working towards sibling support programs, because we often focus a lot on the child who has these needs and the environment, which could be the school and the home. Now, one of the things we tend to miss out sometimes in this busy schedule of catering to the child is the sibling. Either we have siblings who are older, who tend to take up the responsibility much early, right? So let's say there's a 3-year-old who has a special need, and there's a 5-6-year-old sibling. Now, this sibling is always made to adjust, always made to understand, or always made to give a little less attention because they can cater to themselves. Now, a lot of times these siblings may felt left out because they're still not mature enough to understand that there's a lot of need for the younger one. So we do want to start sibling support programs where these children are made to understand what is that the sibling has, how can they be a part of it, how can they support it, and also parents to help them design strategies, activities, curriculum, so that the older child's also equally catered to, because we don't want them to take up the role of an adult. They also have to enjoy their childhood. They also have to learn. They also have to feel loved. So we want to bring in the sibling support program as well, which will help the older sibling understand and be a part of this inclusivity for the child at home.
But do you think this has increased in general, or is it because now we are well prepared for, or to find out, or we have the means to find out whether there are child or children in need?
It's a combination of the two, I would say. Right. Definitely the awareness is a lot better. The screening tools are better, criteria is better, awareness is better. But we're also seeing a drastic increase in number, which could potentially be a lot more to do with our epigenetics, which is how the environment affects the way your genetics are expressing. There's a lot of research that's going on in this in terms of the food, the lifestyle, the screen time, the kind of chemicals that we are exposed to. So a lot of these also play a role in how our genetics are getting modified. So potentially there's a role of this. It's not confirmed yet, but we are looking towards that very closely to understand.
So your journey, Haneesha, why did you choose this role that you're doing right now?
I was always very passionate about pediatrics. So in my pediatric training, we do have rotation into various subspecialties like cardiology, neurology, developmental pediatrics, and so on. When I did developmental training rotation, it was very, very interesting for me. And I did see a lot of need which was coming up. And also, I felt I belonged there. And so it evolved as a passion. So I went on specializing further into this field of development and behavior. Now I'm able to do a lot of work exclusively in that area.
Well, you have featured in many podcasts, and this is one of them as well. So thank you very much. Which was something which was very close to your heart, the topic that was very close to your heart? Or is there something that you want to speak on right now to add on to that?
The topic very close to my heart is one, definitely neurodiversity and inclusion, because that's a very high need of the hour, because we're seeing such a high awareness build up. So we want more people to come in as a community and not just families with neurodivergent children to be able to support that. Two, what I would really like to also talk about is early intervention, because that plays magic on the child's brain. So that's something which I'd love to talk more about. And thirdly is, of course, about autism and ADHD, and also a little bit about dyslexia, because these are three common conditions which we see in school-going children, which if picked up early can make a really huge difference for the child and the families.
Okay, so let's speak about early intervention and how that helps, Haneesha. Since you're the expert.
Yes. So the brain development starts right in utero, which means even before the baby is born, right? Especially the sensory system. So let's say the baby's hearing right when it's in the mother's womb, which means the voices, mama talking, the breathing, the gut sound. So that's how the system is developing. Now, this development of the brain is maximum in the first 5 years, which means by the 5th birthday, we're talking about the baby's brain being 95% of an adult brain size. And that's a huge improvement in terms of, or rapidity in terms of the brain development. So as we speak, every second, there's a million connections which the baby's brain is actually establishing, right? So this early period is where you're able to modify these connections. And that's what we call neuroplasticity. So it's the ability to rewire to the environmental experiences. So early intervention plays an important role because we are able to catch this part of the brain development, which is so very malleable, and it brings out the best outcomes.
The second point you said was awareness. So how do we bridge that gap?
At this point, I would say it's more about being informed and being actively participating. I'd like to know more about this, but at the same time, with people who are aware or in this field, to try bring in this information to the community as a whole. And it could be through different mediums. It could be through social media, mass media, or even it could be through, workplace informations, chatting, schools, through their children. So I think we need to have multi-pronged approach in trying to build this information into the community to help better awareness of what is developmental delays, or what is autism, or what is a learning difficulty, what does inclusivity mean, or what is collaborative, support a child is receiving. So it's predominantly for every lay person to have an understanding that, okay, I know about this condition. This doesn't sound Greek and Latin to me. I know something about, what this is. And as a person, how can I support this? And that becomes very, very important.
Yeah, you know what, when you said workplace, it's very important that there's awareness also in corporates, because everybody is looking for a job. The neurotypical people are looking for a job. What about the neurodiverse? Do they get any opportunities? So when we go to schools and education institutions, they are already trained. And like you said, the training for the kids and the community within the school, I would say, is open and are getting aware. But we are not seeing that kind of awareness even in corporates, at least not that I am aware of. I may be wrong, but don't you think that also would play a greater role?
I think we do have a lot of scope. There's a lot of gaps, so that bridge needs to be established in that front. And like we were planning earlier, I think we need to come up with a lot more mediums in which this can go on. Starting right from work organization. So we can have a lot of talks or chats or coffee mornings, just giving them an understanding, seeing what, is their awareness about this or what can be bettered. And like you rightly said, we talk a lot about schools, collaborations, children, and a lot of maybe child and adolescent, but not a lot about older. We do have a lot of specialists who do advocate for neurodiversity in workplace environments. Like you rightly said, somebody with ADHD, for example, they may tend to lose focus a lot. They may have difficulty in being on time. They may have difficulty in prioritizing and organizing themselves. So these could affect their work a lot, right? And even as an adult, getting diagnosis becomes very important because one, you understand these are a part of who you are or how your brain is wired. It's not that this person is purposely being late every time or inefficient in the work that they're doing. And this becomes important is because when you recognize this is where my skills have a scope to improve, I'm able to do the right thing to work towards it. Be it strategies, be it counseling, be it seeing the psychologist, being learning about yourself, or be it medication sometimes. It really brings an improvement in all aspects of your life, not just at work, your family, your social, your self-esteem, your ability to understand why you're functioning in a certain way. And that becomes very, very important.
So what is the role of a development pediatrician?
Right. So we do know children are seen by specialists who are pediatricians, right? So right from birth to understand their growth, their well-being, vaccination visits, or even visits of acute illness when they're sick, have a cold, cough, or a fever. So we do see them. Similarly, whenever there is a concern raised about a child's neurological development, which could be any milestones, be it physical, their language, their social abilities, their intellectual abilities, or even certain behaviors sometimes, which could be challenging for parents. Now, that's where the role of a developmental pediatrician comes in. So the pediatrician is able to identify that this area needs to be further evaluated or analyzed by a specialist, and thereby gets a referral to a developmental pediatrician. Or sometimes school picks up that there is an issue with the development or behavior, or there's some concern going on, and thereby gets focused to a developmental pediatrician. So we analyze the child's abilities in depth. And like you asked earlier, how do we do it? At this point, it's no blood test or a scan which will tell us, you know what, these are your strengths and challenges. It's a lot of clinical expertise. So we do have a lot of tools which are standardized globally, which we use to help us analyze the child a lot better. So this gives us an overall understanding of where the child stands, what are their needs, what are their strengths, and how as a team, which means the parents, teachers, school, everybody put together, are able to cater to the needs of this child so that they can reach their potential, and these needs just don't become barriers for them as they're growing older.
So when you say a team that works with the child, this is a question that always is there in my mind, Haneesha. So probably I'll ask you and you let me know, is qualification everything, or a person's understanding or bond with the child and the ability to see and be present in the moment not enough?
I would say it depends on the role that person is going to take up.
Sorry, I was talking about the support staff, not the lead.
Okay. The support staff, again, with schools, for example, we do have LSAs, which are the learning support assistants, when the child needs support for part or a full day in school. Now, these LSAs also need qualifications to be a part of the team, which means they do have a learning support assistant kind of a degree, I would say rather, which helps them have a bare minimum information about what is neurodiversity, what could the needs of the child be, or what is that we need to be equipped with to be able to cater to this child, right? So at that point, yes, qualification is like a bare minimum for them to, you know, be accessible or be enrolled by the school or the parents on board. But the other part of it, like you very rightly said, is the motivation, the rapport they're able to build up, the experience they've had with families with neurodivergent kids. Personally, I've seen a lot of these LSAs being parents of children with neurodivergent kids. So they do understand that the needs are so very different from, or the parenting is so very different from a neurotypical child. So they go ahead, do this training to qualify themselves as support assistants or inclusion specialists, and they are able to cater to the children. Whereas sometimes we do have, let's say, nannies who need not be qualified, but it could be somebody who's experienced enough to understand how to handle this child, how are the behaviors different, or where is that they would need help, where is that they need to be pushed to be more independent, and so on.
The reason I ask this is because the more people that come to support or volunteer, would they need such kind of certifications?
It's from a community point of view, I wouldn't say a qualification is a must, as long as they're trained enough to understand what their role is going to be. But if we are talking about school or a therapy, then yes, we would need them to be qualified along with the experience that they're going to gather.
And for an LSA, what are the qualifications that are needed?
They do have an LSA degree by itself, which is a part of special education needs. And that is a training program which they go through to be able to cater to children of various needs.
So it's like a 3-year graduate program.
Yes, sometimes they do also have shorter programs for about 18 months or so, and after which they have an internship kind of a thing where they get trained, observed, and then hands-on with the children.
And the things that they need to do, like the prerequisites that they require, would be a science background?
Not necessarily. Even a basic degree is all right.
So this is a question that I asked Dr. Arif as well. And it's about parents willingly coming to either their pediatrician or a specialist. But say, for example, the school tells the parent, that they find irregularities in the milestone, and they would recommend them to visit a doctor. Now, how many parents do you think would know about the milestones, and also how many of them are open to visiting a specialist? Because the fear of a parent is always, would my child be labeled after this? And then there are also other concerns. You see, sometimes when it comes to doctors, they some people they generally fear going to the doctor.
Right. That's a very valid question, because I do come across that a lot as well. Parents do have a bit of a hesitancy because they do not know what the next steps would be or how this is going to affect the child. A lot of times I've had parents who would be coming in saying that, I do understand these are the concerns, but we're scared this might just label the child and exclude him from his school or from his community or from the group that the child is in. And there's one thing which you would have heard me say a lot through a lot of other interviews or talks, is what I tell the parents: this is not to label but enable your child, because it's only when as a team the school's able to identify what the needs are, they can support a lot better. So when the parent comes in, we have a detailed chat with them, trying to understand what their side of concerns are or perspectives are. And we do see sometimes the children may not exhibit these behaviors at home, but they're a lot more prominent in school, be it attention, social abilities, learning abilities. And we do tell the parents that the need for having a detailed understanding is we can set up this pathway from all the sides or all the angles that are possible. And this would certainly not exclude your child in the classroom. They are going to bring forth accommodations, or they're going to modify things around to the best of their ability so that your child is thriving better, accessing the environment better. So let me give you a simple example. A child who has attention difficulties or is hyperactive, potentially having ADHD. Now, the school environment needs to also be slightly modified for this child to access better, which means the child would do better if they're closer to the teacher and not closer to the door or the window where the distractibility is a lot more. Or the child might need a lot of motor breaks, which is short breaks in between the tasks, to be able to focus better than doing tasks for a prolonged period of time. So these accommodations will help them function a lot better, right? So giving them extra time when they're working, or giving them a space which is a little more quieter than the rest of the class. These are small changes in the environment, but it can optimize their ability by almost double. And that becomes important. So it's only when we recognize these are the needs, the school or the teachers are able to bring forth these modifications or support your child in those areas. And that becomes very, very important. Or even like we were saying, establishing the study buddy system, or establishing peers understanding that, okay, he doesn't impulsively say out things because he means it, but because of the potential ADHD, and okay, it's all right, maybe the next time we can work towards how it is. So a lot of inclusivity builds in those angles as well. And that's the reason why it's important for them to choose the step, which is very scary, I do understand from a parent's perspective, but that's the first and right step towards getting the right help.
You did mention that sometimes at home those
behaviors.
Thank you. The behaviors are not noticed. And how is it prominent in school?
Right. So going back to our example, so let's say attention difficulties, right? Now, these are predominantly where children struggle with sustained attention for long periods of time. Now, at home, the environment is not so structured. Like, you're not expecting your kid to sit and just consistently focus on something for a very prolonged period of time, right? And perhaps in the home, the environment's a lot different. You don't have kids shouting around, somebody screaming, something happening outside, a lot of noises. So the sensory environment is a lot differently designed. So this may not necessarily bring out the challenges. But in the classroom, let's say, the same structure can cause a difficulty, because I need to listen to the teacher for a prolonged period of time. And that may be challenging for me. So I get bored. I move on from one task to another. I daydream. And these get easily picked up because you are in that environment requiring those skills. But at home, may not really. Okay, he got bored, he's going and doing something else, he's coming back doing something else. So it just passes off as, the child's interests are changing rather than the difficulty that the child is having.
Before a child joins any school, there's an interview, there's an assessment. Your thoughts on the assessment?
The assessment perhaps is to understand the child in various aspects, right?
So how ideally would an assessment setup look like?
It would be with the parent and the teacher or the school team that is sitting there to assess the child. Now, this could be at the level at which the child is potentially going to start school. It could be FS, or it could be a particular grade level, or it could even be, just transitioning between FS to year 1 and so on. Now, usually this is a part of, I would say it's divided into a free play part where, they're just understanding how's the child interacting, what is their communicative abilities, how are they playing, and things like that.
Interacting with whom?
The parent, with the, the school team or the teachers who's going to be there, just to get a gist of understanding how is this child socially performing. They do have some bit of, I wouldn't say academic, but I would say learning related assessments sometimes. Like, for a FS child, it could be identifying numbers, colors, shapes, how is he focusing when these activities are given, or asking them to draw or scribble something and understanding how their motor abilities are. So it just gives them an overall glimpse of how is the child's development, and is there any specific areas we're recognizing that the child has difficulties in right at the beginning, so we can be ready as a team to support this child, be it motor difficulties or be it hand skills are difficult for this child. So what adaptation as a school can I do to help this child do better? And this is another area where a lot of referrals come from. They identify that, okay, your child's, let's say 4, come in for FS level, but we see the child's not talking yet. The child's not able to express, they're not able to answer our questions, they're not able to interact with us. So maybe they may find a classroom environment very difficult because of these skills being very limited. So they reference saying that, can you get your child assessed by a developmental pediatrician and help us understand how we can support your child? Where are the needs, and how our school or our curriculum can be best adapted for your child?
Say, for example, you have diagnosed a child with a neurodiverse condition.
Mm-hmm.
Is your role done there, or do you support them after as well, and do you guide them?
For most of the understanding, like you very rightly said, once they see the developmental pediatrician and they've got a diagnosis for their child as to what is the condition the child has, for the parents, it feels like, okay, we've got an answer to what we've come for, and that's about it. But honestly, I think we are at the beginning of the race line, or the beginning of the start line, right, of the journey together. Now, we have understood what your child needs, and that's the starting point, and we have a long way to go. And as a developmental pediatrician, we become a part of their journey all the way into childhood, adolescence, and sometimes even into adulthood, because the child's needs are very dynamic, changing from time to time. So the needs the child has today may be different from 3 months from now, a year from now, 2 years from now. And our role becomes very important because you are trying to integrate these services into the child's day-to-day life. So what is the role of the parent? What is the role of school? Is your child ready for school at this point, or maybe later? Or can we say the child goes to nursery for now? Or what are the therapies your child would need as a support system? So we try to build in that holistic approach to nurture the child's abilities. And regular follow-ups become very, very important because you are changing the plans as per the needs of the child, right? So for most parents, we do tell them that this is not the end of what we've had. This is just the beginning, and we have a really long way ahead, a lot of milestones to achieve, a lot of ups and downs we're going to see, and we are going to be a part of your child's care, supervising overall on how, these things are going to be set in line with them to help them obtain their best potential.
And the support for the parents?
As well, yes.
Okay.
So that's also the other very important thing, because for parents, especially when I would say for a lot of parents, it could be very new. They may have just heard this diagnostic condition for the first time and they have no idea what it's going to be, how it's going to be. And educating them, supporting them is going to be very, very important. And that's again, which we do offer as parent support programs. Myself with a clinical psychologist and a few other team members are going to sit in with the parents to help them understand. Now, in the beginning, this could just be giving them a lot of emotional support, a lot of information to understand what is going to be through. But in the journey, I would say it's also important for us to understand what their situation is. Be it, okay, my financial resources are going to be limited for this term, and what do you think is most necessary for my child? Because we do know insurance doesn't cover therapies a lot here, so that's going to be a lot of financial burden for them. So sometimes they have to pick one, although they do understand both is what is necessary. So there is again where our role can come in, saying that, okay, maybe at this point, let's focus on this and let's try work on the other aspects by yourself or through some resources that we can provide to you, and let's go through. So along this journey, this becomes very important. One person who can guide them, who can help them understand what is the right thing to do, or sometimes a lot of alternative therapies come into picture, a lot of people giving them a lot of other advices. And as parents, Google doesn't help. It just confuses you all the more. So to have somebody whom they could, just go back to and say, okay, I've heard this. Do you think I should try this for my child? Understanding, because you've been with a child, you know what helps or may not help. So that is very, very important for a family who can take you along in the child's journey.